Hello, this is Dr. Steve Weiner, and I want to talk to you today about acne scarring. As many of you know, I'm a very active doctor on Real Self, and this is our most common question we get is how do we treat acne scarring? So let me first digress a little bit and tell you how people get acne scars, and this little chart here will help us. So what happens with acne is you get inflammation in the upper skin area, and it causes pus, and eventually what happens is when it gets cleared, there's some scarring and some collagen, and it causes a defect in the skin. This is basically a rolling scar. I'll get into that a little later, but it causes an obvious deficit in the skin. So let's skip over over here, and I'll talk to you about what types of acne scarring there are. There's ice pick scarring, which is a very small but deep acne scar. Then there's the rolling scars, which Bellafill, which is right here, is used to help. And that's just a smooth kind of crater in the skin. And then there's the boxcar scars, which is like a pockmark scar and has very well-defined borders. These can be treated with Bellafill, but they're harder to treat. So anyways, let's get back to Bellafill. Bellafill is one of my treatments for acne scarring. And it's the only filler that is FDA approved for acne scarring. So it has a 90% satisfaction rate at 1 year. And another study shows that Bellafill can last 5 years or longer. So basically, I think this is a rather long-term or permanent solution for acne scarring. So what do you do with Bellafill? And by the way, I'm a teacher for Bellafill, and I also lecture for Bellafill. So I go into doctors' offices and train them how to treat acne scarring with Bellafill. So what you do with the Bellafill is you first subsize, which means you cut those attachments from underneath the scarring away from the scar so that you have a little space there, and then you fill that with Bellafill. It takes approximately 2 treatments to get to the best results using Bellafill, sometimes more. So Bellafill is one of the things that I use, and it's mainly used for the rolling acne scarring. Like I said, the craters. Okay, so the best acne scarring that is treated with Bellafill are the ones that are distensible. So when you put your hands on either side of the scar and you can pull it and it goes flat, those are the best ones to treat with Bellafill. So how do I treat the, let's get back to these scars over here, the ice pick scars. So the ice pick scars are different, and the mainstay of therapy is using the Infini, which I'm going to get into, but other treatments include TCA cross, which is a very high concentration of TCA peel, like 80 to 100% concentration. And you kind of scar that up, and it gradually closes from the bottom down. And it's safe to use in all skin types. Other treatments, which I don't recommend, are excision of this area, because you're just replacing one scar for another, and I think that that's not as effective. So let's get over to the Infini. So this is the Infini, and if you guys don't know, I've been using the Infini for over 3 years. I'm a lecturer for this company. I'm a researcher for this company. I'm a physician trainer for this company. So I'm a very huge believer in this technology. What this technology does is it inserts radio frequency deep into the tissues. It uses needles to get there. But the key behind this technology is that the needles are insulated. So when you put the energy through the skin, the upper part of the skin is protected, which is great because there's a lot of people that have dark skin with acne scarring. And if you don't protect the upper skin, it's at risk for hyperpigmentation, which means increased pigmentation. And that's a hard problem to fix, but it's treatable. So anyway, so the Infini is great for all types of acne scarring, and it's my go-to device, and several of the thought leaders in dermatology and other doctors who treat acne scarring, it's their go-to device. I have treated acne scarring with other devices such as lasers, including a CO2 laser or the Fraxel, which is a non-ablative 1550 laser. And the results aren't even close to what the Infini is. The Infini requires 2, 3, maybe up to 4 treatments. Its downtime is 2 to 3 days max with some redness. And the results you start to see at 3 weeks, and you begin to see most of the results by 4 to 6 weeks. And we recommend treatments every 4 to 6 weeks. Okay, so my typical patient comes into me with acne scarring. I treat them with the Infini 2 to 3 times. If they're volume depleted, they need to be repleted with filler. And if they have scars that remain after the Infini, I treat them with Bellafill. So that's sort of my protocol. Sometimes there's a subcision done without the filler, but almost always do it with filler. And we seem to have very happy patients. Patients come from all over the country to get treated here for this acne scarring protocol. So please give us a call. Thank you, Dr. Steve Weiner.